Good morning to all of you joining us for our Genesee Health Plan Health Yes Talk Back segment this Thursday morning. Joining me today is Dr. Rizwan Danish, an oncologist, and Jim Milanowski, of course, President and CEO of Genesee Health Plan. Thank you both for being here. Today we're talking about colon cancer. So if you missed our segment at 9 a.m. just now, we will recap that, of course. It is Colon Cancer Awareness Month, and we're talking about the signs and symptoms of it, prevention, and early detection, of course, why this is important to Genesee Health Plan. So if you have any questions, since they are health-related, if you don't feel comfortable leaving them in the main comment section here of our video, you can always Facebook message TV5, and I can ask Jim or the doctor those questions anonymously. You know, let's start by asking and kind of recapping for folks who didn't join us at 9, what is colon cancer?
Colon cancer is basically what cancer is an alteration in the gene of the cells which control the gene's function, whereby the cell becomes autonomous. It begins to grow and grow and grow. And also the cells have a mechanism of death also. If the cell becomes very toxic, and there's a program where the cells can die. And when cancer develops, this death cycle is prohibited, so the cells continue to grow. So what happens within the colon is some or a few of these cells become altered in this way and begin to grow autonomously and become essentially a live organism within an individual, and that the propensity to grow and spread throughout the body through the bloodstream and the lymphatics.
Now, what are the signs and symptoms of colon cancer that folks may notice while this is occurring?
The most common symptom is change in bowel habits.
Okay.
A lot of people are used to having regular bowel habits, and a change, particularly a prolonged change. Everybody gets changes for short term based on various things, but prolonged change in bowel habits is a sign that should be checked with the doctor. Also, ominous signs include blood in the stool, black stools, patients that develop anemia for unknown reasons, particularly if it's iron deficiency anemia, abdominal pain. Those are the most common subtle signs. And then sometimes the signs are more dramatic, where patients end up in the emergency room and in a hospital with severe abdominal pain and catastrophic things. And those are usually picked up, by the hospital's testing process.
How is colon cancer diagnosed and treated?
The most common way it's diagnosed is with a colonoscopy.
Okay.
Diagnosis of any cancer requires tissue sampling and evaluation of the tissue under the microscope to be 100% sure it's cancer. And so colonoscopy is the easiest way to make the diagnosis of colon cancer. And then after the diagnosis is made, then individuals are assessed to determine how much cancer is in their body. So generally they undergo they undergo CAT scan of the entire body to see how much cancer is in their body. And then a lot of times, most of the time nowadays, we pick up colon cancer early. And so treatment for early colon cancer initially is with surgery.
Okay.
Listen,
yeah.
There's the colonoscopy, but then there's also the ones that you do at home, and you get the fecal sample, the stool sample. What are is that as effective, or is the colonoscopy the better way to go? Talk about that.
You're kind of segueing into screening.
Yeah.
So the diagnosis of the cancer, you need colonoscopy.
Yeah.
For screening, there are several options.
Yeah.
So generally, for standard patients who are average risk for colon cancer, patients that are high risk, for example, if they have family history, strong family history, or they have inflammatory bowel disease or polyps, they're a separate category.
Yeah.
They need to be screened younger and more frequently. But for the average individual, generally the screening, there's several choices that are recommended. The first is the colonoscopy.
Right.
So it's recommended that individuals have a colonoscopy at age 50, and if that's normal, then this be continued every 10 years until they're at an age or they're at a time where they have sort of about a less than 10-year lifespan. Then it's generally not recommended. Then a second way is fecal testing, and there's several fecal tests. The most common one nowadays used is these multi-gene fecal assays, the Cologuard and the FitDNA. That's very accurate. It looks for cancer gene within the stool, and that can be done every 3 years. And it's as good of a screen as felt to be as colonoscopy. Okay. Then there's 2 other older screening tests. There's a biochemical screening test called the FIT test that has to be done once a year, and then the old-fashioned hemocult, you may remember, that's more cumbersome. That has to be done annually and on 3 stool samples for screening, and it has higher false positives because people can have hemorrhoids and bleed for that reason, and they end up doing more unnecessary tests. The multi-gene assay is probably, the stool test is probably the best one. You only have to do it on 1 stool sample every 3 years. Okay.
Now, who is at risk, doctor, for developing colon cancer? This is something we didn't get to in the 9 o'clock show. Is there any particular risk factors over others?
Yes, so there are certainly, if you have a family history of colon cancer, the risk is higher, and some people have genetic conditions, it's rare, which predisposes them to colon cancer. But for the average individual, the risk for colon cancer includes smoking, heavy alcohol intake, eating a lot of red meat, particularly processed meat, like hot dogs and
lunch meat.
These cured meats oftentimes are associated with higher risk of colon cancer. Sedentary lifestyle, obesity. Those are the most common risk factors for colon cancer.
Wow.
Yeah,
like
a
all
lot.
Of us.
So eat healthy, get moving, and yes, that's what you want to do, right? Okay.
Yes.
You may have mentioned this, and I missed it because I was listening to the meat preservatives and lunch meat and hot dogs. But genetics, is that at all a risk factor for colon cancer? Yeah, yes. I'm sure. And so it's important to tell your doctor that.
Right. If you have a family history of colon cancer, it's very important to tell your doctor, particularly if there are multiple family members, and particularly if you have a family member that's close to you, like we call first-degree relative, brother, sister, mother, father, first cousins. If they've got colon cancer at a young age, less than 50, those are telltale signs for there being a genetic condition within that family. And there's lots of testing. I mean, we do genetic testing in our office, several times a week in patients that are high risk.
Okay. We talked about this in the 9 too, but I'm going to ask Jim again. We talk so much about, if you've seen any of our other talkbacks with Genesee Health Plan, their specialty really is prevention. So whether it comes to mammograms, pap smears, just regular dental checkups, and especially things like colonoscopy. So Jim, tell us why, this is important to Genesee Health Plan in particular.
Well, it's absolutely crucial. Again, if we can prevent a more serious illness or diagnosis from occurring, and as the doctor has described, it can be taken care of. Those polyps can be removed right during a colonoscopy. So not only are you getting the screening, but you're getting a lot of the treatment right away. I mean, it's almost like a no-brainer, but that's easier said than done. And I know at the health plan, we're really trying to raise our rates of people, our members getting colonoscopies, because it's just one of those things that just, no offense to the doctor here, but it's just not a fun thing. People are all geeked up and want to get a colonoscopy.
Right.
So, but once they do, it's really reassuring that, I don't have these. Or they found a polyp, they removed it, and then they can be sent, like you said, to get diagnosed properly.
Right.
So.
We talked about this at 9, so I'm going to deliver on my promise.
Right.
We are going to talk about Jim's colonoscopy. No, I'm kidding. We're not going to talk about it in detail, don't worry. But you are one of those people. This is good because he sort of has a testimonial for folks that need to get one and are putting it off. You have to drink all that stuff. It's not fun. But like the doctor said, you are under anesthesia a lot of the time, so it's really not that bad. So explain maybe sort of your experience, and you definitely, I know, feel better knowing that you're preventing it.
Well, it might come to a shock for you, Sarah, and others that I'm over 50. So I'm 53.
I'm shocked.
Yes, absolutely. But, and for a couple of years, I'm like, I got busy. I put it off because the doctor's right. My doctor, my primary care, really started encouraging me to get it right at 50. And probably because he knew I probably ate terribly and all those other factors that he described as well. So, and so I finally scheduled it, and you get a lot of paperwork explaining the prep work, and so you're having to clean out your colon.
Right.
The whole digestive system has to be clear. So you take a product that I mixed with, I think it was Diet Gatorade or something. It has to be clear liquid, because it'll mess up the procedure. And see how scientific I am compared to Dr. Danish here. And so you do that. You do that all day, and you can have broth, and you can have a few other things, but it's basically you're in the bathroom the whole time you start about 24 hours before the test is going to be administered, and you're just cleaning it out. And so, I did it on a Sunday, did the prep work, so then on Monday I could just go in. So it's like a 2-day process, because you have this procedure, and then you're really supposed to not go into work after it. So I did it on the weekend, and that was much better for me. I was able to schedule it that way, and so I would encourage people to do that. But once, like Dr. Danish said, once you get in there, it was one of the most unique experiences I've ever had. Where they got me into the room, and they said they were setting up the IV to sedate me, and they got me on my side. And I remember looking at the clock, and there was one of the attendants talking to me, and literally I must have been put out, and I woke up, and I was on my side. I could see the clock, and it was like 10 minutes later or 15 minutes later. And I'm like, and I just kind of woke up, and they're like, yeah, you're all done. Nothing came up. You're all set. And it was like the easiest thing.
Right. So the prep is probably what you hear from patients is the hardest.
Yes.
Yeah. Okay.
Yeah.
But worth it.
You really are knocked out, and it was just a gentle sleep, and just like a little quick 10-minute nap, and you're basically ready to go. So it certainly was more fear going into it than the actual process was.
Sure.
So.
I want to get to a viewer question now. Donna asks, does Genesee Health Plan cover colonoscopies?
Yes, we do. We cover those, and then we need to look into covering this new test that Dr. Danish described, this Cologuard. We probably need to cover that as well, so that there's at least 2 that we cover the older ones that he mentioned, but we probably need to find out a little bit more about this Cologuard and cover that as well. So, but we cover colonoscopies, and we cover some of those other older tests that Dr. Danish described. Not the Cologuard yet, but I imagine that's coming for us. So,
sure.
Yeah.
Don asked, does diet have anything to do with colon cancer? You touched on that a little bit.
Yes, just to mention again, it's very important. There's more and more information about diet. One of the reasons and this has been going on for a long time, but there's pretty good evidence that eating a lot of red meat, processed and cured meats, heavy alcohol intake, and lack of fiber leads to higher incidence of colon cancer. The fiber you have to be careful with, because the processed fiber is probably not healthy, but the unprocessed fiber is the one that's felt to be healthy to take in prevention of colon cancer.
Sally asked, does Genesee Health Plan have anyone on their staff that assists with nutrition and healthy diets?
Yes. We have a team of health navigators, nurses, and health educators that really sit down and work with our members on not only trying to encourage them to do these preventive tests, but also to talk about their diet and exercise and all of that. And so that's very important to us and our members. And we've talked about this on another show. We have this Wise Woman program that we are in charge of for the county, in Genesee County, that really we're working with women that are 40 and above to on these issues of nutrition and health and heart health and all these things, so that they can, and then they can get their mammograms and other preventive services, just because it's so important to have that. So yes, we have staff that'll do that.
And then just to touch on that issue of diet, nowadays the worst thing in diet is sugar. So limiting sugars is very, very important in diet. And as far as colon cancer, and also sugar indirectly leads to colon cancer because it causes obesity. And obesity has been associated with colon cancer. But then, the other things I mentioned, the most important thing really is to eat what's called a healthy diet, limit your red meats, limit the processed foods, increase the fiber in your diet, unprocessed fiber. Those are the important things about diet.
And there's sugar in a lot of stuff that we eat. So, all right. Marianne asks, how has treatment for colon cancer changed over the last decade?
We've made a lot of, the improvements in colon cancer has been incremental. So year by year you see very little change, but when 10, 20 years go by, there's a huge difference. But there's changes in every aspect of it. In the screening, as we mentioned, it's Cologuard. It's actually tests the DNA in the stool for cancer. In the tests, the MRIs, the PET scans, there's special MRIs now they can do of the pelvis for rectal cancers that are much more accurate. So our imaging and evaluation of cancers have gotten better. The colonoscopy has pretty well stayed the same, although the gastroenterologists are better at doing it, the anesthesia is better, the prep time is better. The treatments, as far as surgery is concerned now, in most hospitals, they do the colonoscopies robotically, laparoscopically and robotically. So the recovery time is faster, the blood loss is less. Patients, they go home faster from the hospital, so it's a lot easier. Then as far as the drug therapy is concerned, that's where the huge change has been. As our scientists are finding more and more about the cancers, the DNA, the genes that cause cancer, we're getting more and more treatments that target the cancer specifically and less toxic to the body. So even though chemotherapy is still the standard in colon cancer, we're adding immune therapies and we're adding targeted therapies. In some cases, we're only using targeted therapies, and this is just going to grow more and more in the future.
Wow, wonderful. This is a private message to us from a viewer that asks, I have had a colonoscopy before and they had to remove a polyp. Am I still at risk?
I would, if you had a polyp removed, it depends on the type of polyp, but generally you are at risk, or higher risk, and I would contact your gastroenterologist. They probably have already made an appointment for you. They usually, after removing a polyp, somewhere between 1 to 3 years later, they usually would recommend a second colonoscopy. So what the gastroenterologists do, if it's a big polyp, they usually do a colonoscopy a year later. If it's a very tiny one, perhaps 3 years later. And then once the colon is polyp-free, then they can go to intervals of 5 to 10 years.
Sure. Victoria asks, when should you get screened for colon cancer?
For the average age individual, age 50. And that's the other thing I wanted to mention. Nowadays, people are living so healthy that sometimes when you're 50, you feel like a 30-year-old. You can do all the things, and they don't think they can get sick. But age really does come into play because the age is a risk factor for colon cancer. The older you are, even you can live a perfect life, the chance of cancer becomes higher. It's just the normal, natural way body adapts to it. So it's very important that colon cancer screening begin at age 50 in the average age individual. And individuals who are at higher risk, they have family history, they have family members that had colon cancer at a young age, they should talk to their doctor, and they may need to do colonoscopy at an earlier age.
Sure. Connie asked, does GHP work with gastroenterologists and surgeons? Are they covered under the plan for someone to be seen by them?
Well, we certainly cover the specialist appointment, and then depending on the type of treatment, the medications, the surgery is a lot of times maybe not covered because we don't cover like if it required an inpatient stay, but if it required an outpatient procedure done at a hospital, we cover that as well. Okay. So I guess I can't say it's for sure covered, but in all likelihood it is based on where that procedure was taking place.
Sure. Marcus asks, is rectal cancer the same as colon cancer?
Rectal cancer is a little bit different. Rectum is the last 12 centimeters of the colon. It's called rectum. It's a little bit, it's different in the sense that the prognosis is a little bit worse than colon cancer because cancers in the rectum are better able to get into the blood vessels and to the lymphatics, so it can spread earlier. So rectal cancer is treated slightly different, although we use similar things like chemoradiation surgery, but slightly different than colon cancer.
Sandra asks, are there support groups for people who are diagnosed with colon cancer?
Yes, there are support groups. In fact, at Genesee Early Cancer Institute, where I am, we have support groups for colon cancer. There are online support groups for colon cancer.
Yeah.
The American Cancer Society, you can contact the American Cancer Society, and they will provide you with a list of support groups in your area for colon cancer.
And Carmona's Institute is doing some art therapy with some people who've survived their cancer experience.
Wow.
So, I think there's some good resources out there. It's just a lot of it's not known, and so contact your provider.
Yeah, so if you're interested in something and think that may help, absolutely. This is another private message that says, I just turned 52. I don't have any health coverage in between jobs, but on unemployment right now. Can GHP help me? Should I get tested?
Yes. So I don't know how many questions we're going to get, but yes, all yes. So it's this person sounds like they would be a perfect candidate for the health plan, that they're in between coverage, and so we do that. We provide a coverage.
That's what it's for.
Exactly. As a gap, if they're going and getting another job, or they just lost their job, or they're working 2 or 3 jobs, and their provider or their employer doesn't give them coverage. So yes, so what we can do is it's a very simple enrollment process. It usually takes about 30 to 45 minutes. We'll sit down with you and see, do you qualify for the health plan, or is there any other coverage that you might qualify for? We'll get you signed up, and then you will be assigned to a primary care doctor. We've stressed that over and over. We need you to establish a medical home so that you can have a talk with your doctor about, okay, it's time for your colonoscopy, it's time for this procedure. You have to have that relationship. And so yes, I would say if this person hasn't had a colonoscopy or that type of test and done that before 50 or at 50, then it's time for them to do it. So please, we'll give out our number later. Please call us and we can get that taken care of.
Sure. Rayanne asks, where can I find more information about colon cancer?
There's a lot of information now online. There's a website called cancer.net, which comes from the American Cancer Society, which is very, very good. It's information for patients. The websites of major universities, Mayo Clinic, MD Anderson, Sloan Kettering, they're very good. But you have to be careful about information. Just like in every field, there's a lot of misinformation out there as well. There's a lot of fear-mongering. There's a lot of people who are selling things that are really not well established to help for profit, and they put all these fancy websites and advertisements online. So you have to make sure that you get your information from the credible source.
Sure.
Are there any trying to take care of this? Any fads out there, or things that you probably have heard of that people try to do, maybe organically, to do this?
Oh, there's hundreds of, particularly once somebody has cancer.
Right.
There's probably thousands of fads, in this country and around the world.
Right.
And you have to be careful. Make sure that, and also be careful about information from friends and relatives, because a lot of people have information, but it may be partly right and partly not right. And I would just suggest that you talk to your doctor and get the information from your doctor. And again, these websites that are credible, I would go to them.
Stacy asks, I have to have my first colonoscopy next month. I hear the prep for having one is intense. What is involved?
So I'm not a gastroenterologist, but I have a little bit of an idea, and I've also had a colonoscopy.
Good.
But generally, I think it starts about 2 days before. They give you the idea of colonoscopy. They want to do a colonoscopy and have your colon completely free of stool, so that they can see small polyps. They can get a very detailed evaluation of your colon. And so it's very, very important that you are compliant with the prep. But generally, different gastroenterologists will have different preps, but generally starts a couple days before with some liquids, and then they add more cathartics and more cathartics. And for the last, 24 hours, you're only on liquids, and then for just the day of the test, you're not supposed to eat or drink anything.
Right. There was a stool softener involved.
Right.
Yeah, it's
it's not all that fun, Stacy, but
yeah. So you just you just got to do it.
But it's important,
and you just got to clear out that part. Sometimes it's hard for us to clear, so you just need to clear that day ahead and that day of. So it's really a 2-day process. But again, a lot better than running to the doctor and getting surgery or whatever based on having it then. So it's better
and you want to make sure you do it properly,
Yes.
because if it's not done properly, then the gastroenterologist cannot examine your colon very well, and sometimes they have to repeat it, or it's kind of a suboptimal evaluation. There's certain areas in the colon they might not be able to see well, and they might say, well, it's not worth for you doing another one. So it's very important that you comply with the prep.
Okay. All right. Thank you both for joining me today. If you want to reach Genesee Health Plan, you can visit their website, geneseehealthplan.org. You can call 844-232-7740. Now, if you do have questions that you ask after our live stream here has ended, either someone from TV5 or Genesee Health Plan will get back to you and answer those questions. So if you have questions and you think you can't ask them because we're finished here, please don't do that. You can message us or leave them here and we will get back to you. Thank you so much for joining us for this Talkback edition of Health Yes.